Hi, I'm Lexi. I'm a functional medicine practitioner at River City Pharmacy in Decatur, Alabama. The F word. I'm talking about functional medicine. What is that exactly? I get that question all the time. In its simplest form, functional medicine is the medicine of why. Our goal is to determine how and why illness occurs and then address the root causes, not just the symptoms, and ultimately promote optimal wellness. I guess you could say it's a personalized systems-based approach, not a symptom-based approach that aims to identify where exactly the dysfunction is in the body and let that guide treatment. Speaking of dysfunction, chronic conditions such as diabetes, high blood pressure, ADHD, depression, and much more have increased significantly over the past 50 years or so. However, our genes haven't changed much over several hundred years, so we can't blame it all on bad genes. Genes can be turned on or off depending on what signals it receives from the body and its environment. This includes things such as food, movement, stress, and sleep. So these things can cause disease, but they can also treat disease. So yes, I'm telling you that the food you eat doesn't just taste good, it's telling your body what genes to express, which will ultimately lead to how your body functions on a day-to-day basis. This day-to-day baseline function could be lack of pain and full of energy, or it could be an overly sensitive stomach and high blood sugar, among other things. It all depends on what information your body gets, good signals or bad ones. To create a treatment plan, we look at two major categories. Things that need to be removed, like toxins, allergens, microbes, stress, and poor diet, and things that the patient is missing and needs to be added, like food and nutrients, hormones, water and air, movement, sleep, connection, and purpose. You have to treat the whole person to create wellness, not just the symptoms. It's also important to remember that one condition can have many causes and one cause can result in many different conditions. So what works for one person may not be the exact same thing that works for another. Because of this, functional medicine builds a treatment plan for each individual and often ends up resolving multiple symptoms from just a few interventions. I hate to say anything, but pretty much anything. Some of the most common things that people see improvement in or see completely go away are inflammation, pain, weight loss, high blood pressure and blood sugar, allergies, asthma, skin issues, ADHD, depression, and a lot more. Many people are even able to come off of some or all of their long-term medications, and overall people just feel better.
Hi, my name is Bill. I was introduced to functional medicine several years ago, and I have to admit I was very skeptical. My engineering brain wanted to see health and nutrition like a bank. Calories in were offset by calories out, so I could eat whatever I wanted to, as long as I exercised. My wife and daughters, however, worked with a functional medicine practitioner to address stress, inflammation, food intolerance, and weight challenges. They approached health differently. They approached health and nutrition like a science lab, test, and then treat to balance out the deficiencies in the body while allowing their bodies to heal naturally. In a relatively short period of time, my family showed signs of healing. They slept better and seemed to have a higher resistance to infections. They lost inches, managed stress better, had healthier skin, and seemed, well, happier. It wasn't an overnight change, but it was worth the effort. I, on the other hand, hadn't lost any weight and still felt tired and fatigued. So 8 months ago, I made the life-changing decision to listen to my family's functional medicine practitioner. We started with the elimination diet. I won't lie, it was a challenge, but I learned which foods caused some of my health problems, like bloating, fatigue, gas, brain fog, and congestion, and which ones didn't. I learned to try new recipes, and they were actually good. I kept a food journal and noted how I felt, and then I tracked my weight daily after reintroducing each inflammatory food group. I couldn't believe the results. Over the course of several months, I had lost 22 pounds and went down 1 pant size, and I'm working on the second. More importantly, I was able to come completely off of my blood pressure medication, and I felt alive again. I had much more energy and I could focus better, both at home and at work. I will continue to consult with my functional medicine practitioner on a regular basis to ensure that I'm staying on track, eating well, and living a life of health that I have never experienced before. If you're watching this testimony, my advice to you is this: don't wait like I did. Seek the wisdom and encouragement of a functional medicine practitioner. My life has greatly improved as a result of this program, and I intend to follow it for the rest of my life. If you are married, I urge you to do it together. Family is a great support system, and you owe it to both yourself and your family to take back control of your health.